Hi and welcome to this posture therapy routine designed to help us reposition our rib cage, release a really tight diaphragm, which can often keep a pelvis like really stuck, give us things like backache, a really sore upper body, so really stiff shoulders. It can limit how much we're able to sort of move naturally in things like a workout, playing sport, in the gym, etc. And we're also going to be working our shoulders, a lot of our arms in this routine. So any kind of tension in the forearms, the wrists that could be contributing to really tight upper body. We're going to address that in this routine, as well as some lower body release. But we're going to start with the upper body predominantly, allowing us then to access good function in our legs. For this routine, you're going to need a set of blocks and a foam pad or a really thin cushion. You're going to need a strap and a couple of rolled up towels. And it's about a 30 to 35 minute routine. And we're going to finish with a couple of exercises against the wall. So, without further ado, for our first exercise, what you're going to need is a block. And this first exercise is called the prone diaphragmatic breathing, prone diaphragmatic rib cage release. And it can be a little bit sticky for a lot of people to use the block in this manner. If you find like it's just too sharp, it's too much on your diaphragm for this exercise, please just cover the block with a towel or another really thin cushion, and then just gradually work yourself up from there. What you're going to need to do for this exercise is you're going to use the block on the flattest setting, like so, on the floor. And then what you're going to need to do is place the top left corner of the block just under the sort of dome of the left rib in that little divot, and the same with the right side. And then you're going to come and lay prone, which is on your belly, just draping yourself over the block. And then you want the lower left sort of corner of the block just above the sort of divot of your left pelvic bone, the right corner of the block just in or sort of into the divot of your right pelvic bone. And this first exercise is about 5 minutes. So I've got my timer on. And what we're doing here is we're gently just coming over to drape ourselves over this block. Now, what I want you to do is just gradually, very gradually, just work into this routine. I wouldn't recommend this routine for a newly prenatal mother. So if you're newly pregnant, I wouldn't recommend this routine. This particular exercise for obvious reasons. And for those who are prenatal specifically, I would just get onto the block and see how you feel. If it feels too much for now, perhaps come back to it at a time that you feel comfortable and that your sort of muscles feel like they can handle it. And if you've had a C-section, also, I wouldn't recommend this within the first, I'm going to say 1 to 16 weeks of your cesarean, because obviously the scar tissue hasn't healed. And what we're doing here is with the feet into the floor here, we're just rocking our pelvis side to side, just to sort of soften up all that abdominal wall tissue, allowing ourselves then to be able to soften over this block. And then what you're going to do is you're going to stack your left palm. Stack the left palm over the right, bring your forehead just on top of the left palm. And we're going to keep our feet active for this exercise because we're also just doubling up into the lower body. So feet are hip distance, they're not feet together. Legs are not zippered, they are hip distance. My right foot's already cramping, which is probably a good sign of restoring something in my right leg that needs to do just that. And all I want you to work on is a really good point into your feet. So really feel like you can point the feet, point the toes. If you start quivering like I am, if you start shaking, cramping, any of those kinds of sensations, that's all a really good sign. And then what I want you to feel here with your abdominals is that it can just get a little bit hollow over this block. And you're just gradually just sinking your abdominal over the block. Head is completely relaxed, shoulders are relaxed. Neck is relaxed, and I want us to just breathe here very gently. We're going to do 2.5 minutes with each sort of stack of the palm, and then we're just going to change the position of the palm. Breathing here in this prone diaphragmatic release with active feet. Breathing in through the nose, out through the mouth. Keeping those feet active and just focusing on releasing even more into that abdominal wall tissue. Noticing if maybe the right side, left side feels different. For me, the left side feels a lot tighter. My left shoulder armpit also feels like just can't release as nicely and as easily as the right side. And then we're going to switch the stack of the palms, bringing your right palm on top of the left. And again, just release. Bum is completely neutral. We're just working the feet here. Trying to relax the glutes as we activate the feet. For some of us, that's hard to isolate. Just giving that a little bit of a note in your head. Just over a minute for this right side hand stack, and then we're going to come into the next exercise. Breathing here, noticing the difference in your whole body from the feet. Maybe each calf feels different. Certainly feel the difference between my right and my left calf. Certainly feel the difference in my right thigh, right hamstring also compared to my left, and both my feet. And therefore, each side of my sort of psoas, which is the long sort of muscle that connects the rib through the front of the pelvic bone to the inner thigh. I feel like my left one's really, really tight, and right side's a little bit softer, if you like. I can feel something release hip. So last 30 seconds. Just observing. Good job. And then from here, just pop yourself up onto your forearms before you come off of the block. Just take your time. And gently just peel yourself off of the block, bringing both your feet and your heels, your knees, into a zipper position. Grab your second block. We're just going to straight away transition into our next exercise here. This exercise is called Child's Pose with blocks, and what we're doing with this exercise is a couple of things. with our feet and our knees completely zippered together and our feet in what we call plantar flexion, which is a toe point, we're activating the lower parts of our legs, particularly the feet, and bringing ourselves into a very deep hip flexion, which promotes a really nice sort of curve of the lumbar spine. Most of us are prone to have either a flat back or an anterior position in the pelvis, which really sort of puts the rib cage in an awkward position. But now that we've released those muscles in and around the ribs, the abdominals, what we're going to encourage is now the hips to sit in really nice flexion as we then elevate the arms and release anything into the sort of lat area, armpits, biceps, triceps, forearms, and the wrists. So you're going to bring blocks on the flattest setting, shoulder distance apart, not wider than shoulder distance. So be aware of your setup here with the blocks. As you come down into your child's pose, you essentially want your biceps sort of brushing the side of your ears. And then keeping your palms really nice and flat and active on the blocks, you're just lowering your head here. And then I want you to learn to soften your elbows, but keep your palms nice and flat on the blocks. Now, for some of you, this is going to be quite hard, and that should be an indication that there is some kind of dysfunction, if you like, in your hands, your wrists, your forearms, but also that leads to an inability of your shoulders to then come into a nice neutral position over your rib cage. And then your elbows are soft here, but they're not touching the ground. So your arms really need to feel like there's just got some kind of a pull from the base of the palms down towards your elbows and your shoulders. And then keep your palms really nice and flat, fingers wide. And all I want you to do, if your head doesn't get to the floor here, don't worry about it. Again, that's usually a compensation of an inability for you to get your pelvis in a nice neutral position, but also flexion and internal rotation of the femur. And just breathe here. Just holding this for 3 to 4 minutes. Really relaxing those elbows down towards your face and inwards. Any shaking, quivering, that's a good sign. Blocks are staying flat on the floor. And if you have trouble getting the palms flat, I would suggest bring the blocks slightly closer towards you, just until you feel like your elbows are about to touch the floor. Also releasing in the back of the neck here. Breathing in through the nose and into the back of the rib cage. Maybe as you breathe in, notice maybe one side of the shoulder feels different to the other. I can really feel this in my right sort of base of the wrist, where the thumb and the pinky finger meet, just towards that center point of the wrist. With all the breastfeeding, holding my baby, my right wrist, right forearm really feels like it needs a lot of attention lately. And I'm definitely feeling like this is helping. Good, last minute here. Keep those heels really working hard together. Don't let them drop outwards. Good, 5, 4, 3, 2, and 1. Amazing. You put your blocks off to the side here, or just to the top of the mat. And you're going to need your foam pad for this next exercise. Sorry, beg your pardon, you won't need a foam pad for this exercise. You will need your strap and 2 towels. You may need your foam pad for the next exercise as an option. Your first roll of the towel, just noting that the towels are rolled, I'm going to say 3 inches in sort of radius here. And they're really, really soft, okay? So they're not really tight, so to speak, and you've got the first towel just under the nape of your neck, and you're going to place the second towel just under your lower back with a strap just around your thighs. And this sort of tightness of the strap is to be able to have your knees, ankles and hips in a hip distance position, so not wider than your hips and not certainly wider than your ankles, in that position. Okay, and then we're going to come and lie down with this first towel just into the nape of the neck in what we call towel settle. You're going to grab the second towel and just place it into the lower back. So please note that the sacral bone, which is more towards the tailbone, is not your lower back. Essentially what you want is your ribs staying really nice and neutral, and you want to find the space that's just underneath your last rib and just above the pelvic bone, that sort of heart-shaped bone in the back of your body. And then move your feet a good distance away. So you don't want the heels too close to the back of the thighs. You want them a good distance away. Keeping the 3-point contact of your feet down into the ground, so big toes, pinky toes and the heels into the ground. And then bring your arms in a 45-degree position, shoulders down into the ground without effort. Fingers wide, thumbs down into the ground as much as you can. And you're not doing anything except focusing on the feet, keeping all 10 toes down and all 3-point contact of your feet down into the ground here. You're not pulling the strap, you're just letting the thighs relax outwards into the strap. The strap's going to hold the thighs. You're completely relaxing your jaw, your mouth. It's just the fingers that are wide. They're not exactly pushing themselves down into the ground. I don't want there to be any lift or rounding of the shoulders here. Ribs are completely neutral. Now, for some of you, the second towel may not feel so good. So right now I feel like this is completely relaxing. I feel like my spine is neutral from the back of the neck into the tailbone. But for some of you, you really might feel like your ribs are popping up. If that's so, I want you to just remove this second towel and just allow your pelvis to be led by the back of the neck and the towel behind the neck. So some of you may need to just take that second towel out, see how you feel. And we're just going to hold this for our next 5 minutes. I want you to just completely relax. Focusing on your breathing here, in through the nose and out through the mouth. Relaxing the jaw. Inhaling and exhale. Noticing which foot feels like it's harder to keep down on the ground. Noticing whether your knees want to sort of veer off to one side. I certainly feel like it's really difficult to keep my big left toe down on the ground. I've got a more acute bunion on my left foot than my right. And what's really, really interesting for me is that my head just feels like it's kind of lopsided here to the left. Now, as some of you know, I've just had a baby and she prefers my left side, like my left breast. So I'm always turning my head to the left, even when I change her. Somehow, basically, my body is just kind of mechanized this side, and it kind of rolls my right shoulder forwards in rotation and therefore lobs my head over to the left side. So I'm just noticing this. I'm not trying to do anything. The towel just behind my neck is going to help me reposition my skull by putting my spine and my pelvis and my shoulder blades in the right position. I'm just noticing the difference. I can also feel both my shoulder blades starting to feel like they are actually there and working themselves into the ground. And I can feel like my left one twitching a little bit. So if anything's happening in your body, some of you might feel tingling, pins and needles. Some of you might feel shaking, quivering. All of that's really, really good and generally a good sign of restoring function in parts of your body that were lacking it, so to speak. I'm also finding it more difficult to relax my right inner thigh, so my groin area. I'm just a little bit more aware of that. Focusing on letting the belly rise on the inhale and exhale. Taking your attention inwards. There's nowhere else you need to be right now except inside your body. Not worrying about external things that are out of your control. Breathe in and exhaling. Got 30 seconds or just 45 seconds on the clock. Last 10, 9, 8, 7, 6, 5, 4, 3, 2, and 1. Good. And then very gently just roll over to one side and just come up. Now you're just going to, need the strap for this next exercise, so just keep it handy. And option 1, you're just going to get rid of the second towel if you haven't already, the one that's under your lower back. And then for this calf and hamstring stretch with towel, you're going to need to tighten the strap so that it just fits around your midfoot and the ball of your foot. So the noose of the strap is pretty much your foot distance, foot width, like so. And this is called a calf and hamstring stretch. I want you to be able to keep the towel just under your neck, just keeping that sort of awareness of what feels like a neutral neck position. So we're just supporting the head with the towel under your nape of the neck. Now, for whatever reason, if having the towel here doesn't help you establish a neutral head position, for some of you, you might feel like your chin is still jutted up to the ceiling and you're looking kind of backwards in periphery. If this is you, then I would prefer you didn't use a towel and you just brought a sort of foam pad or a block under your skull. But for those who feel like, actually this feels really good, my head feels like it's in a neutral position, then I want you to keep the towel under your neck. So for the first part of this stretch, we're going to be stretching the right calf, okay? So you're going to bring the strap just around the ball of the foot. And then what I want you to remember is this exercise is it's not going to be conducted by pulling your strap forcefully. And the first thing I want you to remember is I want you to hold the strap under and not over. So many people hold the strap over and then your elbows kind of pop out to the sides, you're rounding your shoulders, your neck is going to jut up. And I actually think this encourages your abdominals to activate, and I don't want that. So you're going to hold the strap from under and bring the hands just to the sort of top of your belly with your elbows relaxed. And you're conducting this exercise by working your ankle and the foot, and that's the whole purpose of the exercise, is to restore function in the lower sort of legs. And then what you're going to do is keep your left knee bent, left foot a good distance away from the back of the thigh. And then what you're going to do is gently, about 40-50%, maybe 60, you're going to pull the strap with the hands. You're going to flex your right foot and keep the right knee in line with the left, or maybe a little bit higher. Spread the toes and really pull your right ankle towards your right hip. So we're not just working the big toes here, you're really learning to put a good amount of dorsiflexion back into the lower legs here. And we're just going to hold, no tension in the neck and the jaw, the mouth. Breathe here. We're holding this for 1 minute. Bum should stay completely down, sacrum is down to the floor. Belly is completely relaxed. So if I just run my left hand over my belly, it's really nice and loose here. So learn to isolate foot function and diaphragm and the abdominals. So this also connects you back to our first exercise and why we do it in this sequence. Right knee is completely straight if you can get it there. Just breathe. If you've got shaking going on, that's not a bad thing. Just breathe through the shakes. Allow the body just to release. Good. And then we're going to take the noose just around the midfoot now. And we're going to access the hamstring now. So we're still holding the strap from under. Hands just on the top of the belly, elbows soft. And then what you're going to do from here is you're going to spread the toes, bend your knee, and bring the foot as if it's kind of coming over the line of your face. But again, your sacrum is not lifted, right? Your sacrum is completely anchored. And then I want you to bend your knee, bend, 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 bend. And then as you pull the strap very gently, I want you to feel like you're lifting your foot up towards the ceiling, but bring your toes down towards your face. Just breathe. So really getting deep into the hamstring here. Notice my knee is bent. Many of us have been taught to straighten out the leg here to get into the hamstring. It's not very functional. And I also believe when your pelvis is stuck, but also your shoulders aren't able to stay completely neutral and your belly can't disengage, you're not actually accessing the hamstring. You're doing a lot of other compensatory sort of stuff. Right leg shaking, keeping the left foot grounded. Just breathe. Good. And then release. We're going to go straight over to the other side. Right foot will bend, right knee will bend, right foot to the ground. And bring the strap just over the mound of the left foot. Nice and firm with the noose. And again, just be aware of where the right foot is. Right foot, good distance away from the back of the thighs. You want the leg completely straight for this exercise, for the calf part anyway. You're holding the strap from under, hands in towards the belly, elbows soft. Spread the toes really nice and wide. And really feel like you're bringing the foot in towards you. Not the toes, but the foot. See if you can flex that foot even more. Remember to keep the sacrum down. And then from here, we're going to go straight into the hamstring. Bring the strap just around the midfoot. Keep your knee bent. So really feel like your thigh's coming in towards your chest just to start with. And then hold the strap down in towards your belly. Elbows are soft. Keep the foot coming over the line of the face. And then feel like you're extending the leg in this position, but it will not straight out. Just breathe. Really soft knee. Keep the right knee in check. Don't let it drop out. Don't be loosey-goosey with the right foot. and then release. Nice. Release the strap and roll over to one side as you gently take a minute if you need. Just come up into standing for our next exercise. We've got 2 exercises to go, and for these 2 we're going to be using the wall. For this next exercise, you're going to need to use your block, and you're placing the block right between your feet with your big toes compressing the block on the flattest sort of setting or the lower setting, and your ankle bones are squeezing gently also into the edges of the block. And you're going to come and stand. I'm just going to demo this facing the camera. You're going to come and stand with your right arm to the wall, arm's distance. Now for some of you, to maintain this straight arm, a few things are going to happen. One, you're going to sway away from the wall with your hip, and we're trying to get your hip stacked above the left knee and the left ankle. But the other thing that might happen is the elbow wants to bend or the shoulder wants to roll upwards, and it will stay in this kind of stuck position. Okay, so what we're going to try and do, and this is all a sort of sign that there may be some tightness in the forearms, the wrists, the rib cage, as well as your pelvis and the lower leg. So what we're going to do here is we're going to spread the fingers of that right hand really, really nice and wide. We're going to keep the whole of the base of the palm into the wall, so there's got to be no cupping. Index finger, root of the index finger, root of the pinky finger, and the root of the thumb are all pressing into the wall for this one. And then what you're going to do is you're going to keep your elbows soft if you cannot get the elbow locked out without there being some of these awkward things happening. And then what you're also going to try and do is keep the elbow crease rolling upwards. So there's this kind of corkscrew effect of your forearm into that sort of direction of the wall. And we're just going to hold here for 2 minutes each side. As we come into the last few minutes, I'm going to face the right side, last few minutes of this posture therapy routine. So here we want feet facing forwards, just get into your position, make sure there's no lateral sway in that left side. If you need to bend the right elbow, that's okay. The other thing that's really, really important is that your right palm is just above the line of your right armpit, but in line or in plane with the right armpit, okay? So if I kind of put my left hand right in mirror of where my right palm is, you can't see the right palm. And this is kind of where you need to be able to have this hand on the wall. I'm currently working on getting probably 2 cameras for my posture routine, one in front so that I can always film it with the wall, and the second one obviously face on. It's not as simple as it sounds, but yes, I'm always working on improving my tech. So I hope you understand what I'm saying. Try not to engage your glutes, just let the block reposition your wonky pelvis or misaligned pelvis, as it also puts function back into the lower legs. As you also reposition your spine here, the shoulders, and put function back into both your forearms and your wrists. Your gaze is eye level, and you're breathing. Disengage your abdominals, inhaling, and exhale. Inhale. And exhale. Inhale. And exhale. Inhale. And exhale. Last minute here, and then we're going to switch sides. My right arm's now shaking. I'm also finding it really difficult to keep the right root of my index finger on the wall. Also, a really good indication of the compensations that I've built as a result of breastfeeding, holding my newborn, blah, 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 blah. It's hard. And also playing paddle, because we're always in that sort of gripped position. So that also contributes to an inability for us to supinate into that forearm, but keep the wrist neutral and the shoulder neutral. And then we can release and switch sides. Shake it off. Good. Find your position with your feet, big toes and ankles squeezing the block. When I say squeeze, it's a compression, it's not a squeeze, because if you try and squeeze it, you're probably going to bring your knees together, or you're going to do something really funky with your pelvis kind of swaying. So really feel like you can stack your pelvis above your ankles here, and then bring your left arm lengthways, left palm into the wall, fingers wide. And like you can see from this camera angle, you can't really see my left hand. So essentially, if I did this with my right hand, that's the position that you want to be in. Again, elbow crease is facing upwards, the left elbow crease that is. Gaze is eye level, abs are disengaged. Gently compress the block. Avoid any sway of the right hip as you push the left palm into the wall. Don't worry if your left elbow needs to bend. What I want you to try and prevent is the shoulder rising up to the ear. So really feel like you can roll the shoulder back and down. A minute and a half to go. Good, here we go, last 30 seconds. And time. Good. We're going to complete this routine by simply standing at the wall. So bringing your heels to touch your wall back behind you. Feet are hip distance. This is not hip distance. This is certainly not hip distance. Really gauging where your ankles and your hips stay right one above the other. So generally what I like to do is just bring my fists over the front of my thighs like so. If I look over my knuckles, I shouldn't be able to see my feet to the sides, or technically just above my knuckles in front of me. And then what I'm doing very easily is just having my palms open here with my head to the wall, bum to the wall, and I'm just standing at the wall. And what we're doing in this last exercise is just reminding the brain and the muscles what it's like to have our shoulders, pelvis, and hip bones stacking right above the knee and the ankle. So we're really just kind of reestablishing load position, but also dynamic tension. So any kind of sway forwards in the body posture, any kind of roundedness in the shoulders, any kind of ski lift off where a lot of people feel their body weight into their toes. This all just kind of takes care of that. Relaxing the abs. Spreading the fingers wide. Again, if there's any shaking, quivering, just let it happen naturally. And relax. Amazing. And I want you to just come onto your mat, just easy standing, and just check in with any kind of symptoms that you were feeling before the start of this routine. So for me, I really felt like the top of my right shoulder was really, really sticky, really cranky. And now I really feel like there's more freedom in my neck, but also my shoulders feel like they've just kind of repositioned, really just eased out a lot after that routine. Anything else in your body that may have felt like really off, lower back, legs, you know, you just felt a little bit low on energy perhaps, I want you to check in with that just as a closing balance test here, making sure that there's more alignment between your balance right to left, so taking your attention down to your feet. Just check in with where your balance is. Mine feels really, really nice and even. Normally, like my left foot just feels like it's collapsing. My left knee also feels like it's collapsing. That really feels like it's not happening. Shoulders are pulled back. I feel like I'm standing tall. Right shoulder feels like it's released. And yes, that should hopefully take care of a lot of symptoms for you, wherever they are. And if it does, then it's an indication that the areas that we've worked today are simply lacking function. And what we've done throughout this posture routine is put function back into those areas of your body, which then helps you alleviate a lot of your symptoms. Okay, so I hope you enjoyed this posture therapy routine. If you have any questions, you know where to reach me. In the meantime, keep practicing.